TMD can have fatal consequences. And then I'll explain. But it is true that temporomandibular joint disorder, it's a singular, it's not a bunch of disorders. It has a bunch of symptoms, and the TMD gurus want to make it complicated by making it a bunch of disorders where they can bring in psychologists and psychiatrists and physical therapists and drug therapists, etc., to treat symptoms, but it really is a single disorder. It's a disorder generated by inflammation within the temporomandibular joint. It's a single disorder. Inflammation creates all the symptoms, so it's best to treat the cause, inflammation within the temporomandibular joint, rather than just go off and call it a bunch of disorders which are related and connected to the symptoms. But enough of that. The topic for today, the title for today is TMD can have fatal consequences. And it is true. So let me explain. Actually, there are three categories of temporomandibular joint disorder that can have fatal consequences. The first category I've talked about before, and this episode, although I believe I have talked about each and every one of these issues before, in prior episodes, we're bringing it all together today under the umbrella of TMD can have fatal consequences. So there are actually three categories. The first category is the sequela of inflammation, that is the consequences of inflammation within this joint, or actually any joint, a nidus, a focus of inflammation within the joint, and the effect that has on chronic inflammation in distant organs and different parts of the body.